In today's video, I'm going to be talking about celiac disease, getting to the root of the problem. Now, for those of you who have celiac disease, you know just how difficult it can be to diagnose it. In fact, quite often it gets misdiagnosed. So do stay watching. Hi, I'm Mike Hines from JustKnowGluten.com, creator of this channel, Gluten Advice. Now, if you like the content, you like the video, why not give it a like or subscribe to my channel. Also, hit the notification bell down the bottom and stay informed of all things gluten on this channel, Gluten Advice. Okay, let's get straight into the content. Celiac disease is one of the most difficult diseases to diagnose. The disease has a range of symptoms. Quite often, celiac disease has been misdiagnosed because of the symptoms it shares with other digestive and allergy-related diseases. There is a whole range of symptoms that can pop up in children who have celiac disease. In adults, it is common to have fatigue, depression, osteoporosis, irritability, and a lactose intolerance. The importance in diagnosing celiac disease is getting to the root of the problem to diagnose it properly. Celiac disease, as we all know, is a condition where the inner linings of the small intestines gets inflamed due to the contact with gluten. Gluten is a protein that is found in wheat, barley, and rye. Now, I have discussed celiac disease in several previous videos, and I will leave a link to those in the description below. You may want to watch them to get better informed about celiac disease. One important point is that there is no cure for celiac disease, but switching to a gluten-free diet should help control the symptoms. You might be relieved to know that celiac disease is not fatal in the normal way we think of fatal diseases. It won't progress and ultimately kill you. But it's not all bad news. At least one study indicates that people who are more careful in following the gluten-free diet may have a lower risk for early death. Once inflammation of the small intestines occurs, the body is unable to absorb the necessary nutrients from the food you eat. So, no matter how much food you eat, you may still experience malnutrition. And the problem arises that you're not receiving the right amount of nutrients for your body will get weaker and become more susceptible to other diseases. Diagnosing celiac disease is a little difficult due to the fact that the exact cause of the disease is still unknown. Research and studies have proven that the disease is genetically based. So what this means is that if someone in your family has it, there's more than likely a chance that you will have it as well. Diagnosing the disease can be done through laboratory analysis of blood samples. What doctors will be looking for is the high levels of antibodies, more specifically anti-gliadin, anti-endomysium, and anti-tissue transglutaminase antibodies in your blood. It has been discovered that people with celiac disease have high levels of these antibodies in their system. What happens is that these antibodies identify gluten as a threat to the body and try to get rid of it, just like the immune system trying to get rid of virus and bacteria. However, there are times that the levels of these antibodies were found to be normal, and yet patients still exhibit symptoms of celiac disease. If you continue to have symptoms of celiac disease despite having a negative blood test, your doctor may still recommend you have a biopsy. A biopsy is carried out in hospital, usually by a gastroenterologist, who is a specialist in treating conditions of the stomach and intestines. A biopsy can help confirm a diagnosis of celiac disease. Now, if you do need to have a biopsy, an endoscope, which is a thin, flexible tube with a light and a camera at one end, will be inserted into your mouth and gently passed down to your small intestine. Obviously, you will have a local anaesthetic before they start the proceedings. The gastroenterologist will pass a tiny biopsy tool through the endoscope to take samples of the linings of your small intestine. This will then be sent to the lab for testing. If you do test positive for celiac disease, you may also have other tests to assess how the condition has affected you so far. You may have further blood tests to check the levels of iron and other vitamins and minerals in your blood. This should help determine whether celiac disease has led you to developing anemia, which is a lack of iron in your blood. If you appear to have dermatitis herpetiformis, which is an itchy rash caused by gluten intolerance, you may also have a skin biopsy to confirm that. Again, this will be done under a local anaesthetic and there's a small sample taken from your skin to be examined in the lab. Your doctor or practitioner may also want to do a DEXA scan on you. A DEXA scan is a type of X-ray that measures your bone density. This may be necessary if your doctor thinks your condition may have started to thin your bones. With celiac sufferers, a lack of nutrients can cause osteoporosis. A DEXA scan is not a test for arthritis and only measures bone density to see whether you're at risk of bone fractures as you get older. It's only when gluten is removed from their diet then they start feeling better. Though celiac disease is a really tricky one to diagnose, but through observations and laboratory analysis, it can be done. If left undiagnosed, the disease can potentially lead to complications and other more dangerous diseases. Some of the risks that people with disease have to be ready for include lupus, diabetes, rheumatoid arthritis, microscopic colitis, and autoimmune thyroid disease. There is also the risk of malnutrition with deficiencies in vitamin A, B, 12, D, E, and K, which can result in anemia and weight loss. The body will also be lacking in calcium, which greatly affects the bone density. The damage caused by celiac disease can also result in developing other allergic reactions from foods that don't even contain gluten, such as lactose. So if you're showing symptoms of celiac disease, do get urgent medical attention. And if your doctor discovers that no, you don't have celiac disease, then that's good news. However, ignoring your symptoms is not a good idea. Hello, I'm Mike Hines from justknowgluten.com, creator of this channel, Gluten Advice. I do hope you enjoyed today's video and you found it both informative and helpful. If so, why not give it a like or subscribe to my channel. Again, thank you for watching and I shall see you in my next video. Bye bye for now.